Cool. And then I will. Wonderful. Welcome everybody to the first open community call. We've been working on this for about a year, but now it's time to finally expand the circle somewhat and loop more people in to the project. The vision is to create a new pathway for decentralized science, for developing veterinary therapeutics. The play is building on the validation tier between preclinical and clinical research. This is honestly where 80% of biotech projects die. They have some promising first steps, and then things just kind of fall apart before being able to actually get a phase two or phase three approval. And why dogs first? We've been focused on rodents for the past, decades, and it really hasn't been translating over to human longevity gains. So there's a lot of studies where maybe the mice live 2 times as long as normal, and then we do that in humans, and it seems to have like no real effect. So dogs are more like us. They have a similar lifespan. Well, I mean, it's closer to us than the rodents are at least, and they have a similar environment, similar diet. So hopefully, if we can make dogs live longer, we can make humans live longer as well. Uh, More information is located down at this vision paper at the bottom. Here, let me give permissions to. Okay, yeah, Blessing, you should be able to manage the new people joining. So yeah, a little bit more about my background. I got looped into biotech through a project working on an HIV gene therapy. That project did not have success, but a spin out of it did have some success, which was using a similar technology to produce follistatin. If you're curious, you're welcome to check out Unnatural Selection on Netflix, which I'm in, and also Citizen Bio, which covers the story of my former company a little bit more closely. That company ended up being MiniCircle. Um, for people who are curious, you can check out this Brian Johnson video. I edited my DNA on a secret island. He ended up getting the treatment after a phase one study. From a high level perspective, plasmids are what bacteria use to interchange information between each other. They don't have sexual reproduction, they have plasmids and they share these information. We don't really do this with humans, but as it turns out, we can kind of take that technology, that biotech, and use it in humans. And so plasmids were kind of the first gene therapy that were heavily researched, but the problem was that they didn't last because the immune system would see all of these bacterial components and then they would kill those cells that had been modified. And so you would end up only getting expression for maybe 2 or 3 days. Um, Now, this new process, we remove the bacterial components that slices it where the yellow and the red are. You end up getting this mini circle plasmid, and then that seems to last for months at a time instead of just days. And it's like probably a safer approach to gene therapy because it's not modifying the existing chromosomes. These are the same plasmids that are featured in the game BioShock, and that was kind of like the magic power up. And uh, let's get more into just like what follistatin does. Follistatin occurs naturally, but it's higher when people are in puberty and when people are working out, which is when people are putting on muscle mass. And so by inhibiting uh, myostatin accelerates lean tissue breakdown. It's part of the metabolic process in which we kind of like eat ourselves to some degree, especially if we're like starving, right? It makes sense to break down muscle tissue. But if we're not starving, it makes sense to just kind of keep accumulating muscle tissue. And so this puts the brakes on that entire process. so that you end up having a little bit more muscle, a little bit less fat. And this is one of the main drivers of osteoarthritis in dogs. It's just that the animal has too much weight and the joints are getting stressed too much. So that is one approach that this is doing. But there's also something else that's happening, which is that follistatin is a decoy receptor for activin. Activins are involved in inflammation. And so if we can prevent activin from doing its job by having this false decoy, then what ends up happening is that there's less inflammation and also possibly less pain reception as well. So this is kind of like a treatment that does two or three different things instead of just one. And most of the arthritis medicines right now for dogs really just mask the pain and don't really actually do anything. The current research is that there are two rodent studies. There is one human safety study, which I organized, and in that was mostly healthy participants, but two of the participants had arthritis, and that's when I realized, oh, there's some potential for this to be an arthritis treatment and not just for putting on muscle mass. And then we've done two canine case studies so far, one being my dog, one being Brandy's dog. Unfortunately, we just have case study data. We don't actually have data from the collars. So right now, the current status is that we pretty much have all the documentation needed for the ethics review board, but I've been leaning towards doing a new like ethics review board rather than trying to go through an existing one. But let's talk more, Emmanuel, offline. We have about half of the vet partners we want for the clinical collaboration. I should start looking in San Francisco again, but we already have Boston, Los Angeles, and Orlando. Hopefully, we'll also have San Francisco and New York. And so, yeah, we've been mostly focused on biometric collars as a way of validating that this is actually making the dog more active. But the first batch of that did not go well because the collar company was acquired and then we lost the data. And so we are hopefully not going to have that problem again, but this is just what comes with startups, new projects. I'm going to briefly go over the team. I don't have any dogs right now, but my family has five dogs, and a bunch of them are golden retrievers, which is pictured here on the left. My background is mostly kind of in crypto and IT, but I got into biotech around 10 years ago, and I've been focused on kind of like developing what DeSci will look like. And so this is kind of my project to put that into practice using something that I think is like a slam dunk in terms of a biotech product. Brandy Nunez is a veterinarian based in LA. Uh, Maria or Fernanda, you're welcome to say hi if you'd like.
Hi everyone. Well, I'm a software engineer. I really been into bioscience, biohacker communities, and also I'm very interested in computational neuroscience, those kind of topics. Uh, yeah, mostly that. I also been doing a longevity protocol with my own dogs. It's the chihuahuas that are in that picture, mostly with rapamycin, keto diet intervention, nutraceuticals, and yeah, mostly that.
Do they complain about the keto diet or are they happy with it?
Uh, no, it was a nightmare at first, mostly
Oh,
the diarrhea issue,
oh
but
no.
yes, it was really really messy, but now they are fine. They go 3 months with the keto intervention, and then 3 months with their rapamycin. I don't mix them because rapamycin is known that can increase the lipids profile, so I separate them to avoid
Hmm.
unflavorable pancreatitis.
Okay, cool. We also have Harshika, who's kind of our biotech intern. She's working on the knowledge management and kind of like how we're doing all of our information. Blessing is our community manager. You've probably seen her on the Discord. Do you want to say hi? Hey. And then Antonio, also on the call, if you want to say hi and a little bit about your background.
Sure. Hi, everyone. Well, I am focusing on the IT side. I have been doing hardware. Also, I have been from the software side. Um, I would I really like to focus in all the cycle of the IT side, from the low basic level to the most advanced side.
Cool. And so in practice, that's probably going to come down to collecting data from participants, making it easy to get that data. That's really one of the biggest struggles with decentralized trials. And then Eagle has also been helping out with community management. Um, it's a great picture. Is that one of Maria's dogs in that picture, Juan? Or is that yours?
Yes, that is one of the dogs of Maria.
Of hers. Yeah, yeah. Cool. And then like a shout out to all potential partners. We're hopefully going to be working with Emmanuel and his treat CRO for canines. He's currently based in New York. Triplicate is our first investor. Minicircle is my former company, and we are probably going to be using their gene therapy platform for the study. Just because I know that it works based on what I've seen. And then we're probably going to be launching with Bio XYZ in the coming months. We'll get into that in more detail soon. Um, I guess at a higher level, decentralized science is the third scientific revolution, and there's a lot of parts of it, and it's honestly can be a little overwhelming because there's just so much that's being talked about, and it's hard to say how much of this is actually going to happen versus how much of this is just an idea. I just want to emphasize that like the focus for dog ears right now is just kind of this like top right, like doing the clinical trials and getting medicine approved and getting it out there. But there's like this entire ecosystem that is developing. And if you're curious, I encourage people to check out this video that I put together on YouTube as part of a larger course on decentralized science. I'm thinking that we might end up getting into multi-agent systems if we have the capacity, the bandwidth. I think that there's a lot of value in using bots as a way of mediating the community. That being said, it's also possible that you end up spending a lot of time on stuff that doesn't end up going anywhere. But right now, we do have one bot working in the Discord that we kind of feed it all of our documentation about the group, the project, and now that bot's able to answer people's questions. But I think once you start having the bots working together along with people, that's when you start getting really interesting effects. And that's another just like a new area that hasn't been done yet, but I think ultimately will be one of the hallmarks of like decentralized science and this new revolution in science. Let's see. So just a quick shout out to the Yapper program. I have to admit, I was intending for this program to coincide with the token launch. However, the token launch got delayed due to the market conditions. So we ended up having this program, but I'm really grateful that people participated. And we'll just quickly go like a shout out to everybody who participated and won. Gramps, who's in this call right now. Nice work. Jarves, Isabella for Twitter. Fubui Hanni for LinkedIn. Thuong and Sugar Glider for Blue Sky. And special category for Chue, Jane, and Faranmi for creative, informative, and funniest posts. All right, let's get to the actual meat of what most of the people in the community are curious about, which is the token sale. This is, to my understanding, what the distribution of the IP NFT or the IPT tokens how it will be structured. And so the team is getting 10%. The actual sale will be 10% of the tokens, but then also another 5% will go to bio stakers. And then a lot of the tokens are just going to be held in liquidity pools, which will be used to create the automated market maker so that people are able to exchange tokens back and forth automatically. And so we're actually only selling a fraction of the IP. Dog Years Incorporated, which is like the original company, is going to still own a good chunk of it. And the idea is to get enough data, enough evidence that this asset becomes really valuable. I've already made the provisional patent. It's been filed. And so we're set up. We just need the data, and that's really where the community comes in. So immediate goals is building out an investor network. If you know whales or VCs or whatever, and if that referral ends up going somewhere, I'm happy to give you a cut of what they invest. So reach out to me if you know anyone who might be relevant. We're looking for people to keep creating content, to be able to post on our blog, to be able to post on social media. So if that's something you're interested in, let me know. We're looking for people to amplify our social media so that whenever we post something, please try to share or retweet it. In the coming months, we're probably going to be focusing more on trial participant recruitment. That really comes down to which areas that we're going to be in. So we're not really focusing quite yet on that. We're going to also be trying to collect information about canine longevity and feed that into like one Google Drive, and then have bots that are able to review that information, so synthesize that information, and hopefully be a asset to the wider community and not just our DAO, but really anyone who's into dog longevity is able to interface with this. And I think that's a good community asset. And then developing contributor onboarding so that way it's more streamlined so that when someone's like, I want to get involved, it's like, okay, well, how, right? Like that's a big task. And I think Eagle and I will be focused on creating kind of like a curriculum to get people up to speed and able to contribute without a lot of hand-holding. Longer term, though, we want to create the evidence for this treatment. We want to develop a long-term longevity study afterwards, which will probably look at multiple interventions. And I guess just to say, longevity studies are difficult because I think in humans, people are going to be doing 5, 10, 20 different treatments, and not just going to do one. And really, I think that it's more likely that there will be multiple treatments that are really effective rather than there being one treatment that solves aging, right? And so our current framework is very focused on just a single intervention, and that doesn't really work well with longevity, if assuming that it does come down to multiple mechanisms of action. And so if we have, hundreds of dogs doing many different treatments, we could potentially look at that data and pull out which are the best combinations and then focus on those combinations later. And that's kind of the idea. Looking to integrate decentralized science with traditional biotech. And so the narrative for that is that this first token sale is through crypto, but then maybe later token sales will be through traditional venture capital. Or ideally, this project gets acquired by traditional biotech, and then all of the token holders get a cut of that, the proceeds for that. I think that if we can create an example of the crypto people funding early research, and then it goes to traditional pathways, I think that's a really strong narrative because crypto people have a stronger risk tolerance. And if we can help fill in that gap between preclinical and clinical through crypto crowdfunding, then it makes it have a more tangible pathway that other people can also go down as well. And then maybe we'll create a pack of science agents. I love the idea of having all of these different bots that look like dogs, and they're able to work together to achieve some sort of scientific goal. And so final notes, token launch date is still to be determined. I've been talking to Bio XYZ. They're waiting for the market to start having some upswing, and I trust their judgment as to like when is a good time to actually launch. But if we're still waiting in like 2 or 3 months, I'm probably just going to go for traditional VC again, hopefully with some more data this time around. And then lastly, maybe we'll have our next call in 2 weeks for the community, but I think maybe we'll do a different time because I think a lot of our community members are in Asia and it's like midnight right there right now. So with that being said, I'll open it up to any questions, comments. Ooh, well, ask to mute. Think we might be good on questions. Feel free to just drop them in the chat. As long as it's not when is the token launch, I swear. It's funny. I guess we'll go from that as being the default question to like when is the token going to moon to the default question. I'll shout out to Penforce real quick. He's been helping writing some of the articles. I need to review them. We've got a good amount of content, but now we need to actually post it to the blog. I guess I'll go ahead and end the recording now.